Okay.
Here it goes.
I don't know. I don't have the agenda.
Oh, I've got it.
Okay.
Can share my screen.
Okay. Not much, really.
It's
Okay.
really agency presentations and public participation if anyone has
Mhm.
anything.
Hi, Julian.
Hello.
Hey, how you doing today?
Good evening. Beautiful day, wasn't it? Isn't
Yes, it was.
Nice to see some sun, huh?
Yep. Oh, Lynn, I took care of the chicken coop. That's what I did.
Yay! I'm so glad.
It was a lot of work.
Yes, I bet. Was it 4 feet?
Yeah, just about.
Oh, wow. Okay, we have enough people that I want to make a couple pre-meeting announcements.
Okay.
If folks don't mind signing into the chat, if they're not a board member or a member of the staff, it's very helpful for us to have that record. Just, put your name and agency affiliation. We have a call-in user who doesn't have, it just says call-in user. So especially that's hard when you call in to sign into the chat. So we might just ask that person who they are.
Hi, Lynn. It's Ann Piercy from Cunningham, and Pat is going to try to get on as soon as she can.
Thank
Okay.
you, Ann. Great to have you.
Thanks.
And the other important announcement is that I am at Brookins, which is where the meetings are normally held. And the notice was posted about this meeting like a week ago. So we're in compliance with the Open Meetings Act. And I can't see everybody because I've got the screen share, but I think you might have a quorum. So if you want to start,
Yeah, looks like it.
I think we're good.
So let's call to order. And Stephanie's here, so could we do a roll call, please?
Susan Fowler,
Here.
Elaine Palencia,
Here.
Kyle Patterson, Julian Rappaport,
Here?
Jane Sprandel,
Here.
John Paul Joachim, Joe Oma Osagie.
Here. Okay. So we have a citizen input. Anybody, anybody at Brookins or anybody here on the call?
Ann Piercy, Cunningham Children's Home.
You what?
And do you want to give public input?
Oh, no. No, thanks.
Okay.
And Joe, there's no one has arrived here.
Okay.
Public input.
So we will move on to the approval of the agenda. So to move to approve the agenda.
I'll move.
I'll second. Okay.
Do we have to roll call or just?
Second.
Okay.
You
Do we
do.
have to roll call or just move on?
No, you have to do a roll call.
Okay.
Yeah.
Okay, approve agenda's approval.
Susan Fowler,
Yes.
Elaine Palencia,
Yes.
Julian Rappaport,
Yes?
Jane Sprandel,
Yes.
John Paul Joachim,
Yes.
Joe Oma Osagie.
Yes. So I have no major comments today other than it was almost 60 degrees warmer than it was last week. So it's a good thing. And I hope most of you had a chance to step outside for at least a few minutes. It's good for your mental health. So,
Amen.
amen. Yes. Study session. Let's get going here. Champaign County Healthcare Consumers, are you guys ready?
Ready?
Let's do it.
Claudia,
Okay.
you can share the screen now. I'm going to stop.
Oh, okay. I actually do not have materials to share, so I hope that's okay.
So,
It's great to see everybody. I miss seeing people. We're doing a lot of our work remotely. Okay. I have presentations for the two programs that you all fund. The services are very similar. The populations are slightly different, and the way the services are delivered are a little bit different from each other. The first program is the Community Health Worker Outreach and Enrollment Services. And I'm going to describe the kinds of services that we provide to the mental health board designated population. And a lot of those services will be similar when I present the next program, which is for the justice involved population. But Champaign County Healthcare Consumers, we're very, very grateful for your financial support so that we can provide these services. The services that we provide are that we help people sign up for health insurance, and it can be any kind of health insurance. We have expertise in all of it, whether it's Medicaid, Medicaid managed care, which follows after somebody qualifies for Medicaid, Medicare, including people who are new to Medicare, as well as people who have Medicare Advantage plans and Part D plans, and they go through open enrollment periods. We can also help people sign up for the Affordable Care Act Marketplace health insurance. And we help with other kinds of programs that help make Medicare affordable to people, including Medicare Savings and Medicare Extra Help. And those are programs that can help reduce the monthly premiums or a deductible or copays for people who are lower income. So we deliver those services. In addition, we also help people sign up for SNAP, which is food stamps. And also we have a prescription drug fund so that when people cannot afford their prescriptions, either because they've lost their health insurance or the copays and so on are too high for people, or right now during this time of year, a lot of people have deductibles for their prescription drug insurance, and then that makes their prescriptions unaffordable when they are at the pharmacy. And you all help to fund that program, and it is a really vital program to help make sure that people don't skip their prescriptions or have their prescriptions intermittently or have to cut their doses. We make sure that people get to keep and take all the prescriptions that they need, whether that's for blood pressure medication or depression or whatever is prescribed. Our work has been extremely challenging since the pandemic, as I'm sure for so many of your other grantees, because of working remotely. So a lot of our work involves really engaging with individuals, helping to determine what needs they have for their health overall, as well as for the resources that they need, like health insurance and SNAP and so on. During the pandemic, we have continued to do the work, and you all fund us specifically to work with people who live in Champaign County, but who may have mental health, emotional, or substance use disorders. And right now, there's also a lot of people who have comorbidities with physical health issues. And some of those could be depression, isolation, loneliness, especially during this time when people can't really get together. And so our work involves, when somebody comes to us, we assess their needs, we have an intake form, and we try to identify as many needs as possible and try to take care of them all at one time. So that might be that somebody comes to us because they can't afford their prescriptions, but then we find out that their insurance has lapsed. And so we help them with their prescriptions, but then we help them get their insurance reinstated. But then along the way, we might find out that they could actually benefit from food stamps. Or now, since the pandemic, since a lot of people have lost income and have lost work, there's a lot more people who need a lot more assistance, including from programs that they have never interacted with before. For example, LIHEAP, which is a low income heating energy assistance program, which can help make their utility bills more affordable. So we try to sort of wrap around people and help them apply and qualify for as many of the benefits that they qualify for. And during the first 6 months of this fiscal year, we have been really challenged with new clients coming forward, greater needs, and then also having to identify even more resources. And so we expanded our services to help people access their stimulus, or it's not called stimulus now, it's recovery payments, or I don't remember what it's called now, but a lot of people need help being able to access those payments. A lot of people need help now being able to access rental assistance and some of the other resources that are available in our community. We also, in the beginning of the fiscal year, or when the pandemic first really hit, we were able to get funding from United Way and some other sources where we could give direct cash assistance to some of our clients who are, in this funded program, because we had people who couldn't afford gas for their, for their cars, or they couldn't afford diapers for their children, or they just had these sort of miscellaneous needs that wouldn't be served by a local program, but where they really just needed money in their hands to be able to meet those needs. And so because of your funding, the clients who we are able to serve through this program also were able to get even additional help. It has been really challenging because basically almost every interaction with somebody during this time, as you all know, becomes a meeting, right? Somebody can't just pop into the office and drop off their paperwork. It becomes a meeting. We have to schedule a time to talk to people, or we have to work over Zoom or over email. But we've been able to do it, and we are pretty much on target with the number of clients who we estimated that we would serve for halfway through the year. We are pretty much on target, but I will tell you the work is just harder and more challenging, and just because of the logistics of it. But the other thing is that people are also really just needing a lot more support. And so sometimes that shows up in the form of people calling us about something that's fairly simple and could be a 2-minute conversation over the phone if we were going to try to be extremely efficient. But we end up talking with somebody for 20 or 30 minutes because they just need that kind of companionship and connection with, another person. And then we also, of course, have a lot of people who are just really, really struggling with mental health and how to access services and so on. And so we've been able to help make those referrals and help people and families. And we have had some pretty complicated cases because of the COVID situation. I'll just give you one example. So we have a family with grandparents who are both disabled. There's an adult daughter who has substance use issues and some involvement with the criminal justice system. She was court mandated to get substance abuse treatment at Rosecrans. And then, and she had been abusive to her family. And so during the time that she was incarcerated and then at Rosecrans, the family got an order of protection. There was a brand new baby. It was her baby, but she had no interest in the baby. The family was taking care of the baby. But then the young woman left Rosecrans and she came to the home unannounced. The door was unlocked. She came in and she basically just said that she had been let out of Rosecrans because her roommate had tested positive for COVID. So now all of a sudden we have a situation where the family is very, very stressed. They don't know whether they've been exposed to COVID. They have a brand new baby and they don't know where this young woman is going to go and if she's going to try to come back to the house. And so we had to work with public health, with Rosecrans and other entities to sort out this situation. And it was in fact true that her roommate had tested positive for COVID. She sort of left on her own and she was not supposed to do that. But so then we had to like pull together all these resources to get family members tested, you know, and help them. And then there was a teenage daughter as well who was just stressed by everything. And she wanted to get into counseling. She self-identified as somebody who wanted help with counseling. And so we were able to work with Promise Healthcare, who has a wonderful therapist who works with children and adolescents. And we were able to make that connection. So that's just one example of a case that was, you know, challenging and involved a lot of people and harder because of COVID and the pandemic and so on. If y'all are okay with it, I know we'll have time to ask questions. If y'all are okay with it, if you have a sense of the kinds of services we provide, then what I'd like to do is move into the justice involved population. Because it's very similar services. We work with people to try to get them their health insurance, their prescriptions, and everything that they need so that they can do better. Now, the pandemic has really, really challenged this program because the way that our program normally works is we have a staff member whose name is Chris Garcia, and he normally works in the Champaign County jails. He works there typically about 3 days a week. And then at our office, he makes contact with people while they are in the jail, often through a referral from Rosecrans, or it can be, you know, somebody from the sheriff's department, a correctional officer or somebody. And people are identified who are uninsured and who will be getting out and who need to start their health insurance application, usually for Medicaid. Well, when the pandemic hit and the mitigation measures took hold, our staff member, Chris, could not be in the jail because the jail was really reducing the number of people who could be in the jail. So then we had to sort of rework the way that we connect with people who are in the jail who needed those services. And it was pretty challenging at first. The jail, the staff from the sheriff's office was making the telephone available so that Chris could connect with people while they were in the jail. But then we found out that that could only work in the evenings or later because during the daytime, the attorneys needed to use the phone to talk to the people who were in the jail. So it just became very challenging, and you'll see the impact on our numbers a little bit, although we're still pretty much on target. But what we ended up doing when we really couldn't have access to people who were in the jail, and I think it's also worth noting that the jail census has been much, much lower during this time, and that people who really officers are making decisions to not book people into the jail if they don't have to. And so the people who tend to be in the jail now are people actually serving sentences. So they're going to be there for a longer period of time, or they are people who will eventually transfer to the IDOC, Illinois Department of Corrections. So during that time, which is still ongoing, when it's harder to reach people, what we ended up doing is going back to find all of our previous clients who had been justice involved clients. So these were individuals who had either returned to the community after serving a prison sentence, or people who we had worked with from the jail who had gotten out now. We just used the opportunity to identify all of them and try to reach out to all of them, and then check in with them, make sure that their insurance was still up and running, or see if they had any needs. And as a result of that, we were actually able to engage quite a few people, and also their family members as well. And that was good, because a lot of times, when we help someone sign up for health insurance, they get their health insurance, but then if it's Medicaid, they have to go through redetermination on an annual basis. And sometimes people fall through the cracks. And so, and they just might not even know that they've lost their health insurance. And so they don't necessarily know to come to us for that kind of help. So we were able to identify these individuals, look up their health insurance status, talk to them, and then help a lot of them get back on their health insurance, and then choose a Medicaid managed care plan that would work for them. Right now, you all were talking about the beautiful weather today, which I agree with. Last week was a nightmare because it was so brutally cold. And we ended up having, I think, 3 different clients who were justice involved clients who were homeless and medically fragile. One was medically fragile as a result of sleeping in his truck, and he was found in a parking lot in his truck. I don't know if he was technically hypothermic, but he was very affected by the cold and had to be hospitalized. And a couple of other situations where people were homeless, but then they were medically fragile and they could not go to see you at home to stay there because they couldn't get up and down off the floor, for example. And so these were individuals who we then ended up helping to place in motels, to stay in a motel once they were discharged, from the hospital. They didn't need to be in a nursing home, and they weren't sick enough to remain in the hospital, but it was not going to be healthy for them to be at CU at home as homeless individuals. And so we pulled together some resources and we were able to help temporarily house them in a motel. And so those are just some examples of the work that we're doing. I can tell y'all stories all day long. I know time is limited, so I'm happy to answer questions. None? Yes.
Go ahead, Julian. Go ahead, Julian.
Yeah. Claudia, I don't expect you to do diagnoses, but since this is a mental health board, and you've sort of suggested this, but I just want to make sure I understand it well. I'm just going to guess that there are some number, maybe you have an idea of what those numbers might be like, not exactly, but just a kind of feel for it, of people who may or may not even know that they really need mental health services and wouldn't want to go for mental health services, but are nevertheless willing to accept the kind of assistance that you provide. And I'm wondering if in that set of people, if they exist, and 2, if you have a sense that there's some number of those people who are actually experiencing serious mental illness, because we know that there's a lot of physical problems that come along with serious mental illness. So the lifespan of such people is quite a bit shorter than it would be for others. At any rate, I'm wondering if you give us a sense of how much of that you're dealing with.
Yeah, thank you. That's a really good question. So very broadly speaking, I would say that about a third of all of the clients that we serve qualify as mental health board clients. But then in terms of the proportion of those who may have an undiagnosed or untreated fairly serious mental health issue, I would say that's probably about 25 or 30% of our MHB population. And as you know, there are some mental health issues where people, or mental health conditions where people lack awareness, right, of their, of their condition, and are therefore resistant sometimes to the, to suggestions about, treatment. That is not unusual at all. I would say of the total population of the MHB clients who we serve, that's probably 25 or 30%. I think it's also pretty high among people who are homeless. And a lot of times, this won't be surprising to y'all, but a lot of times people who are homeless are also really traumatized. And so there's issues, that come with that as well. And they may not talk about it in that way, or even realize that that's something for which they might be able to get help. They're just in survival mode and really focusing on a lot of times material sorts of needs. Now, sometimes when we work with people over time, when we develop that trusting, relationship, there's times then when people will start to open up about something, and where we can talk to them and offer suggestions for ways that they can get help. And so a lot of times the clients who you all fund us to serve do not necessarily come to us because they have a mental health issue or substance use disorder issue. They're coming to us because they need their prescription, or they need their health insurance, or they heard that we can help them sign up for SNAP. And then it's in the course of working with them that we try to get them the care that they need and the services that they need. And the other thing is, a lot of times we're sort of like, we end up working almost as an interpreter for, so for example, today I spoke to two Carl social workers who were wonderful. They're wonderful. But where I had to help them understand the person a little bit better, where there was some resistance with the social worker about next steps, and where, I could help explain a little bit where that resistance was coming from, and we strategized about another way to approach that person and their needs. So I'm sorry, I sort of rambled, but does that help answer your question?
Very much. This is exactly the kind of thing I was suspecting is pretty common, and I think it's important for us to keep that in mind. So I appreciate your going into those details.
Thank you.
No, I definitely appreciate it, because I think very few people that just have just one diagnosis. There's a primary and there's several secondaries.
Yes,
So.
and we know that disabling conditions, and a lot of times it's a constellation of disabling conditions, right? Like physical health as well as mental health or other things, that people who are homeless and people who have been incarcerated have much higher rates of those comorbidities,
Yeah.
and than the general population.
Thank you. So probably, are there any other questions? Go ahead, John.
Hi, Claudia.
John
Thank
and
you.
Elaine.
I want to thank the Champaign County health consumers, for everything that you guys do. I wish that healthcare was a right in this country so that we wouldn't have to, have everyone just, for like have you guys, find people so that you can get them just the first step to get access to the care that they need. Um, a few questions I had was, does the jail screen people for mental health issues and health insurance, and then do they contact you, or how does that play out?
Yes, so thanks to Captain Vogus, who is the jail superintendent, as people are booked into the jail, they have a brief screening for mental health and substance use disorder issues. I don't know right now how consistently that is happening, but that is ideally the way that it happens. And it's a brief screen, and it's a screen that we selected because it had been validated as a screen that could be administered by correctional officers. So then what happens with that screen is if somebody screens, that it seems they might have some mental health or substance use disorder issues, they get a referral to Rosecrans usually. And, I know Rosecrans has had some turnover in their staff, but this is the way normally it would work. So the referral would then go to Rosecrans. Rosecrans would follow up with the person, and if the person allows it, they would do an assessment of the person. But whether they do an assessment or not, when they talk to them, then they find out, what needs they might have in terms of health insurance, and then we get that referral. The other ways that we get referrals through the jail is sometimes just word of mouth. So somebody might find out that Chris helped this other person sign up for Medicaid, so when he gets out, he'll have his Medicaid, and then there's word of mouth. So that's another way that we get the referrals, as well as through the correctional officers.
That's great. Other questions I had were, do you guys give information to the schools when they do registration? Because I know it seems like you guys target the homeless population, which is great. They're higher, probably more disproportionate to having mental health issues, and the same with the jail population. But there's a lot of families that have that as well, especially this year with COVID. And we know from studies that when parents have health insurance with the children, that they're more likely to take their child to the doctor. So it's important for not just for the children to have health care, but for the parent too. So I'm just wondering what you guys do in those respects.
Yes, that is a really good suggestion. We don't blanket the schools, but we can. We have very nice, simple flyers that just say what we can help with, and that our services are free. So that is something that we can work with them on. We do work with school liaisons though, but that is it's actually usually around the immigrant population. So we've done a lot of work with undocumented minors, and through the school resource person. And then of course there's the school health center in Urbana. And so there's some connections that way as well. But we can certainly expand to help get the word out more about our services.
Thank you.
That'd be great. One last question, I promise.
Okay.
Sorry. So one thing that's come up in my clinic today, even we got an email saying that like OSF doesn't take Meridian or Blue Cross Blue Shield Community. And, in the past, I would always tell parents, oh, Meridian's better than Molina for the Medicaid, because, a lot of places take Meridian, but they didn't take Molina. And now that's kind of changing.
Yeah.
And so I don't know, are you guys keeping up to date on which Medicare providers are accepted where for the population? Like, okay, if you live in Champaign, you should really have this insurer for Medicaid, not like Illini Care or Meridian at this point, not Meridian or Blue Cross Blue Shield, because you can't go to OSF. And Blue Cross Blue Shield, you're not really accepted at, I don't think Carl either, because we don't really see those patients. So
Correct.
it's been mostly Meridian and Molina, but so now
Yes.
Molina is more a better one, but it always changes. So I don't know if you guys are keeping on top of that.
We do. That is a fundamental aspect of the work that we do, because when somebody qualifies for Medicaid, most people who qualify for Medicaid will then be given the opportunity to choose a Medicaid managed care plan, such as Molina or Meridian, or Illini Care, which is now something
Aetna.
else. Yeah,
Okay, I know.
Aetna, which now doesn't contract with Walgreens. So
It sounds really crazy.
yeah, it is really a mess. And that's why it is so important to work with our clients directly when it's time for them to choose a Medicaid managed care plan, because to help them choose the right plan, we need to know who are the providers that they want or need to see, and are they in that plan? And then we also have to look at their medications and see how that plan covers their medications, and then which pharmacies. And then the other thing that we have to see is, for example, if somebody has overwhelming dental needs, oral health needs, you know, some of those plans are better than others. And if that's an overarching need, then we'll want to get somebody into a plan that they can use, like at Smile Healthy, for example.
And if you're an adult, you can only go to Smile Healthy if you are a medical patient at Francis Nelson.
That's correct. Although they do have emergency appointments.
Oh, yeah.
For people who are not established as patients. But yes, that gets very complicated. And that's one of the things that we always do. In fact, there's a handout on our website under resources that shows you the Medicaid managed care plans and where you can use them. But yeah, it's tedious and ridiculous, and it all has to do with contracts that are constantly changing.
Well,
Thank
thank you
you.
very much. I'm glad you're keeping on top of that. I just wanted to make sure you guys were doing that. Thank you so much. Thank you.
You're
for
so
all
welcome.
you do. Thanks.
Elaine, do you still have a question?
Oh, I guess it's kind of related to all of this. I was just curious, as the political situation has changed and the Affordable Care Act is now coming back, more, you know, what kind of impact you're seeing with that? Are you yet?
Yes, and we are so excited about it because, well, first of all, one of the things that changed effective December 1 of last year is Illinois expanded Medicaid to allow low-income undocumented seniors into the Medicaid program. So that is very exciting. And so that gives us access. I mean, I think in the state of Illinois, it's just a few thousand people who would qualify, but some are certainly here in this community. And so that's been, you know, amazing. And then you're making reference now to the Biden administration has
Yes.
reopened the Affordable Care Act marketplace in light of the pandemic. And we are actively reaching out to people. We had people who contacted us after the open enrollment period closed last time, and they were trying to sign up, and it was over, it was done. The open enrollment period closed. Now under the Biden administration, because they're not putting any restrictions on it, we can reach back out to those folks and let them know that we can go ahead and sign them up and they can get subsidies. And I think it stays open through May 15th. So we're really gonna go at it full steam ahead and get people covered. And the other thing is, we also tell people, you don't need to know whether you qualify for Marketplace or for Medicaid. We will help you sort that out. So just, if anybody's uninsured, send them our way.
Yeah, thank you very much. You are a fountain of information and lots of information. We appreciate it a lot. Lynn?
We have to move it along.
Yeah,
but
that's what I was going.
One thing that I think is that we really need to watch carefully is the impact of no cash bail, because that brief screening that the jail staff used to do at every shift, they were like 100% for a while, doesn't really matter if people are gone the next day and can't be assessed. So we are going to probably face challenges similar to what you and Chris adjusted to, where you're finding people. And that may also impact Rosecrance's programming within the jail. If people are not there, you can't do the assessment.
Yes. And the last thing I'll say, because I know y'all need to move on, but one of the things, part of our plan because of this, is to actually try to go to the law enforcement departments, Champaign, Urbana, and the others, and do presentations to their officers to let them know about the kinds of services that we provide. And we have small business size cards that are English on one side, Spanish on the other, that just explain very simply what we do. And I know a while back, Joel Sanders at Urbana had me come and talk to, I think I talked to 3 different shifts of police officers, like at 6 a.m, which was, I don't ever talk to human beings that early, but I did that time. And so that's one of the ways that we will try to catch people more upstream, given the changes that you're talking about, Lynn.
Thank you very, very much.
Thank you all so much. Your support has been invaluable, and I'm so, so grateful. On behalf of all of our clients and our staff and our board, I just want to thank you.
Thank you. Thank you. Who's next on our list?
Well, NAMI is next, and we have Diane Zell and Tekli De Kuntz, who's the new executive director of our local NAMI, and she can share the screen.
Okay, let's do it. Thank you.
Give me one moment to go ahead and open this up for you all. Can everyone see this okay?
Yes.
Okay. So just a brief introduction. Hi, I'm Tekli De Kuntz. I'm NAMI Champaign's executive director. And this is my presentation for you all. A brief introduction to NAMI's mission, if you're not familiar already. We're the National Alliance on Mental Illness. We're one of the largest grassroots mental health organizations. Our affiliate is directed to most of East Central Illinois and mainly Champaign County. A NAMI statement for recovery is that we believe recovery means different for each individual person, but the need for support on the journey towards wellness is universal. NAMI is a leader in providing information and support, as well as peer-directed programs. Our personal statement is that we seek to improve the lives of individuals with mental illness, as well as those who love them and their families. I'm sure you can read this as well. I wanted to at least give you guys a brief, if you're not already familiar with our signature programs. We are continuing to offer our Family to Family, which is an 8-week session educational program for families, significant others, and friends of the people with mental health conditions. This is one of our main programs that we invite people to come to. Family and Friends is a program that we hope to be coming in the future. We have facilitators trained, and it's a 90-minute or 4-hour seminar that informs people who have loved ones with mental conditions how to best support them. Ending the Silence is another program that we hope to relaunch during this time. It shares information and presentations with a young adult and someone who is usually a caregiver. We recently just updated our information on that one. And then Connections is a recovery support group, and Family Support Group is another one that we also have. I wanted to at least highlight some of this good stuff that we've been doing. So our family support groups were able to coordinate in-person meetings that abided by the, at the time, COVID-19 guidelines. So we were able to continue our family support, as well as making personal calls to people who had previously frequently attended those meetings. And then we advertised and referred people looking for support groups to virtual NAMI family support groups, as well as a collaborative effort between other NAMI Illinois affiliates. And then we are happy to say that we're going to be having another family to family virtual program starting March 2nd. Lyndon and Slavina, if you're not familiar with them, are our facilitators, and they are doing a great job with keeping on board and keeping people engaged. Another highlight is our NAMI on Campus Club. Diane Zell, who is present here, has worked with the UIUC kids for a number of years, and they host events for both semesters over on their campus. Here is a schedule of some of the programs that they're going to be showing. These programs are open to anybody in the community, and we also advertise with them to make sure that people have resources and get the information. Another highlight we did, I just decided that a lot of our projects were really important to us. We did a social media package through the Community Learning Lab with a UIUC class, and they were able to provide us with a social media package. So they created multiple pieces of content for our Twitter, Instagram, and Facebook. We're really excited to have done this because it's going to be able to boost our reach online with all of our demographics. I went ahead and included our Instagram and Facebook as well. And then our Strides Against Stigma Walk, which is one of the iconic NAMI things that they do. We were able to turn ours virtual, and we hosted a 2-hour NAMI Strides Against Stigma presentation. We included a whole bunch of videos from our peers, our program instructors. Diane as well did some poetry, and we had a very good reaction to that. We adapted to the coronavirus by where business meetings went remote. We were able to remanage our website to keep our community updated on the changes. Our signature family to family class went from in-person to online during that period of time. Our awareness event, as I said before, turned into a virtual event. And then we were able to collaborate with both local organizations and other NAMI affiliates in Illinois, as I already previously mentioned. A lot of these items are also in the report I included for you guys. I have like papers here that I'm looking at. So some other community engagements we were able to do is we worked with Illinois Able and a presentation called Caring for the Caregivers with our community education program / committee. Diane did a couple radio interviews. She presented at the Society of Women in Business. Kim Simpson's AKA sorority presentations with Diane and our previous executive director, Allison, facilitated in a collaborational aspect. We were able to still participate in Disability Expo. I'm sure I'm just reading off of this. I'm sure you all can too. We were able to donate holiday gift bags to local hospitals and recovery centers for their in and out patients in recovery, as well as assist with NAMI Campus Club and their care packages to donate items to make sure everyone was well aware. And then these are our plans for our future. We're working on building and managing our website to create more resources and have people be able to come to us with those questions. So to make it easier to be able to say, hey, here's the stuff that you need to know and how we can help you. We're growing our social media engagements to make sure people are reaching out. I'm moving our entire workspace to Google Workspace to improve our internal flow and a collective place for our organization. And then we're working on collaborations between our committees, including communications, education, programming, and peer activities. Sorry. And then externally, I have this open. We have our Mental Health Awareness Month event planned with Campus Club, and we were also going to be working with other community members, where our Ending the Silence program is going to be continued in the works. We're also doing a Spring Family to Family in March, Family and Friends program to launch, and we're basically just trying to up all of the programming that we should be offering already. And I also included our contact information here. We wanted to say that while our executive board did vote to decide not to apply for a 2021 or 2022 grant with you, our 2022-2023 is still on the table, and we are very appreciative for all you've been able to do so far with the grant funding. And if you guys have any questions, I'm open for them. I know I kind of sped through that a little bit, but I open the floor to you all.
Any questions or comments?
I have one. This is Susan.
Hey, go ahead, Susan.
I wasn't aware that you weren't planning to apply for funding for 2021-22. Could you tell us why?
Yeah, so when first
Thank you.
no problem. Our executive director, Allison Meaner, previously had stepped down as of January 31st. And I was then hired February 1st. However, the deadline for your grant was February 12th. And because we didn't have anything in the works yet, we decided that rushing into a grant wouldn't be the best idea for us. And so we would rather hold off on that and then reevaluate ourselves later in the year.
Thanks.
Mm-hmm.
I appreciate that. Thank you.
Yeah, no problem. Lynn, do you have a question?
Are there other board member questions?
No.
I just want to say, stay in touch with us.
Oh, yeah, definitely.
We have a long partnership with NAMI, even without a grant fund. We have other things we've done together for many years. It's a great relationship.
Absolutely.
Okay. If there are no other questions or comments for NAMI, thank you very much. And we'll go to the next presentation.
I can't pull my screen up yet.
Okay, NAMI needs to take theirs down first. Okay, thank you.
There we go. Thank you.
Okay.
So hello, I'll introduce myself. I'm Gail Rainey. I'm the administrator at Rosecrans in Central Illinois. I work with the part of Rosecrans that does the substance abuse services for Central Illinois. And one of the programs that CCMHB helps fund is the Rosecrans Moreland Recovery Home. And so thank you for allowing us to share our program with you tonight. We're really appreciative of the Mental Health Board funding and support for this program. It's one of our newer programs, and so we do appreciate the help in getting it up and going. It's made a big difference for the clients and the people in our community. The recovery home was started and still is a safe, recovery-oriented environment. It's predicated on providing peer support and intensive case management for the clients, and it operates in a level system. It's a vital part of the recovery process for a lot of the clients who come to us because most of them are homeless or they're from unsafe environments, and they need a place where they can continue their recovery and be able to focus on their sobriety. It's not just housing, and it's a service that is not covered by Medicaid or insurance. So it is vital that we get the extra support. Within this environment, first of all, it is a licensed service by the Department of Human Services, Substance Use and Prevention and Recovery. We're also accredited by Joint Commission, so we have a lot of different regulations and standards that we do need to meet. We're staffed, one of those standards is we have to be staffed 24/7. And so we do have a staff that's led by a credentialed, certified addiction and drug counselor. And so that person is the lead, and we have several other staff that are on duty at all times in the building. The recovery home is a 12-bed facility. 4 of the beds are for females in one apartment, which is separate from the apartment for the males, and there's 8 beds in the males apartment. It's a step down from residential services. In order to qualify for the recovery home, a person has to have around 30 days of sobriety. And so generally speaking, most of our clients come from a residential setting. And then while they're with us, they continue to participate in intensive outpatient and then outpatient services. We do have several clients that are involved with the criminal justice system. We have some who are on probation, some who are involved with drug court. And as we continue to connect them with services, we also help make sure that there's coordination with the criminal justice system if the person's involved with criminal justice. We also, a strong part of the program is also making sure that the clients are involved with 12-step and peer support. During the pandemic, a lot of those services have been provided virtually. We've seen it go all over the place, actually. Sometimes they've been available in person, sometimes they've been virtual. And so we've helped connect the clients and made sure that they had technology available to them to be able to participate. A big part of the client's experience is the peers and the other people in the recovery home. It's really important, again, for that safe environment, but also a supportive environment. So that's often provided not just by the staff, but by the people that live together in the apartments. The staff help facilitate some of the interactions, but honestly, the clients are the ones that support each other in many ways. We do have weekly life skills groups in the recovery home, and they also hold weekly recovery home meetings, along with having different sober living activities. Non-pandemic times, it was a little bit, there were other options available to us where we could do some activities outside of the recovery home. Right now, during COVID, most of those activities have been contained within the recovery home. And so we've been a little bit limited that way, but the clients are still doing a great job of helping each other and making it a really positive environment. We do also help the clients connect to the local recovery community. Like I said earlier, 12 steps and the peer support is a big part of it. And so again, some of those have been both virtual and in person. We help connect people with sponsors. Within the AA and NA community, also some people participate in Celebrate Recovery and some of the other forms of the 12-step community. We find that this helps the clients and provides them some dignity. They get to practice a lot of cooperation and develop respect for each other, trying to help each other develop goals and help each other attain the goals that they have. We believe strongly in providing structure and accountability. So they do have to provide random drug screens, and they also are required to participate in one-on-one planning sessions with the staff member who's assigned to them in the recovery home. It gives them throughout their different levels that they participate in, they get to watch each other and see that they do have some positive abstinent role models within the recovery home, but also within the staff and also the recovery community. One of the big things we see throughout their stay is that clients start to build their self-confidence. They get to practice their coping skills in an environment that's there to help them through some of the challenges that they have. And part of the challenges involve the staff helping them through intensive case management. So we connect clients, like we said, to recovery support, but also to education or vocational skills and opportunities. A lot of the clients first come to us with minimal food or clothing sources, so we introduce them to those resources in the community. Claudia spoke earlier about how healthcare consumers connects people with benefits, and we use them quite often to help our clients get enrolled in benefits. We also, while they're with us, they participate in counseling services, both substance abuse and mental health. Those services don't have to be through Rosecrance. They can be and often are, but we also connect them to whatever's appropriate for them within the community. We connect them with psychiatric and medical and dental services as well. Our clients come to us with multiple needs, and their multiple ongoing needs, and we are helping them to become self-sufficient within the community by helping them learn the resources and how to navigate systems, honestly, that can be pretty tricky and have gotten trickier during the pandemic. We also help them. A big part of some of the triggers for some of our clients is just honestly, once they get a job, they have money, and then what do they do with their money? And so helping them not only with the trigger part of it, but also helping them budget and figure out how are they going to pay off some past fees, for example, or fines that they've incurred in their life while they were using, and they still have those. And so how do we help them through that? And then the ultimate goal is to help them once they found those resources and been engaged and they've been able to maintain their sobriety. The ultimate goal is to help them find permanent and sustainable housing. We do this through intensive case management, but also through a level system. Our clients come to us, like I said, most of them straight out of a residential setting where they've been in a very controlled environment during a residential stay. And some of them will tell you it's very controlled. And so when they come to us, we're trying to help them adjust gradually to back into the community. And so honestly, for the first 2 weeks, they have very little movement outside of the recovery home. They do, with a staff member, go places to get their basic needs met. They start working on things like getting an ID, getting their license, some of the basic things that a lot of us don't stop and think about in our day to day. But when you're starting over basically in a new life, you don't have those things all the time when you're starting out. And so our staff help them get connected, even at something like a social security card. And how do you get that once you're ready to get back out into the world? As they go through the level system, then they increase the sustainability of their recovery efforts. And as we see progress, then they gradually get to have more movement outside of the recovery home. They are less restrictive with some of the things that they have to report in and out to staff. Again, this is all part of the transition back into the community. The whole time, though, we're also helping them and working with them on an individualized strength-based service plan. We sit down with the client on a weekly basis, sometimes more often, and talk about where are you at, what are some of the things we need to help you with, where are you going, what are your goals, and how are you going to get there. And for each client, it's different. And so it is very individualized, and the staff help them to try to find the things that are important to them and important to their recovery. We have been in operation almost exactly for 24 months, a little bit more now. We admitted our first client in February 1st of 2019. Since that time, we've had 37 unduplicated clients from Champaign County. That's not the only clients that we've served, but those are the ones that have been funded through CCMHB funding, and we are truly appreciative of it. We have definitely changed lives throughout this program. The length of the program has been set up to be roughly 3 months, but during COVID and even pre-COVID, that's not a hard 3 months. It's 3 to 6 months, and even at the end of 6 months. And we found housing, especially at the first part of COVID when we had the stay-at-home order in place, housing was very hard to find in the community for our clients. And so we've extended stays past 6 months. It's all based on the individual need, but we do encourage, again, that gradual back into the community. And at roughly 6 months, we're really trying to help say, hey, what's going on? And can we really help you get to where you want to be? Because the other part is they like us, but they don't like us that much that they want to stay forever. So the 24-month data shows that we've had 50% of the people have completed the program. Sometimes we find that they need a higher level of care, whether that's for physical care, medical care. We have had some clients that have left us because they've needed something medically that we can't provide them. And so we've helped them find a higher level of care setting. Sometimes it's for mental health needs, where we've had to say, okay, the recovery home might not be the best setting for you, but maybe one of our mental health group homes is, or sometimes they have been admitted into an inpatient setting for mental health as well. It just depends on where that person's at on their journey. We've had 35% of the clients that did not complete the program throughout the time that we've been open. Even if they didn't complete the program, though, out of all of the clients who have been with us. 77% have found stable housing at the time that they've left us. 78% have been employed at the time they've left us, and 65% had developed what we would call a robust recovery support, where they were actually participating regularly in a 12-step or some kind of a support group, and or they had an assigned sponsor and were doing well that way. We do have a client who's with us tonight, and he wanted to share a little bit of the client experience. So Matt, I'll pass the baton to you if you want to unmute yourself, or if Erica can help you unmute. This is Matt. Matt's been with us for a couple months now, actually. And Matt wanted to share his experience in the recovery home with you. So Matt, I'll pass it off to you. Maybe I can get out of the PowerPoint so that we can see you. So hang on just a second.
Okay.
Uh-oh. All right, there we go. Go ahead, Matt.
Okay. Thank you. Yes, like Gail was saying, I've been a resident here for about 3 to 4 months. Coming in here, I really didn't know what to expect. Really, I just knew that I was going to be living with seven other guys. And I knew that was going to be a hard thing for me personally. You know, during the midst of my addiction, I was someone that isolated themselves. I literally did not leave the house for about 3.5 years almost. The only time I left was, you know, to go down the road to the gas station and get something that I absolutely had to have. And when I did do that, the anxiety that went with it, it was almost debilitating. So I did. I just shut myself off. So coming here, it was a big jump for me. I wanted to be here for the right reasons. I don't know if at first I was. I just knew it would be a safe place to lay my head and maybe kind of collect myself. But my experience here turned into something that I could have never guessed. I mean, kind of like Gail was saying, you know, I needed to like make a foundation for my recovery. I didn't know how to do it. I know I wanted to stop. I didn't know how to. I finally had to admit that I had no control over my addiction, and that I wasn't going to be able to stop by myself. I was going to need help. But you know, the staff here, they make sure that you're taken care of, that you're getting everything you need and then some. If you ask for something, a resource, I don't think I've ever been told no. They do. They set you up for success for life after. Like I said, like they make sure that you're going to meetings. You know, that you have a network of individuals that you can call if for some reason you don't feel comfortable talking to the staff, which I don't think that anybody that lives down here is like that. I think to all of us, the staff is family. We have great relationships with each and every one of them. But you know, they make sure that you're going to meetings, doing step work. And the step work, I found out that I wasn't a big fan of it at first. Sometimes it can be just like reading out of a textbook and things like that, but it does. It keeps me grounded and it keeps me honest with myself. It's definitely taught me that if I'm feeling like I don't need a meeting, then I probably need a meeting if I'm feeling that way. Like a requirement, you must have employment. I think it's after 30 days. I I didn't work for 3.5 years. I was scared to death to go out of the house. Like, I don't know why. That's just what addiction does to you. It doesn't care. I'm now working with the public, something I never thought I would be doing. I'm an appliance sales specialist at Home Depot. I love my job. I do. I love the people going in there. I get to talk with all kinds of different individuals every day. It's just not something that I never thought that's what I would love doing. I always thought that I would want to, be working by myself, just by myself at night, things like that. But no, being here is like, it has made me move out of my comfort zone. It's forced me to. And it's turned me into a better person because of that. The staff, they make sure that that you know how to do a budget, that you're saving money for life after, and the ultimate goal is to find independent housing when you're done. I'm on my way to doing that. I'm looking at places now. Like I said, my counselor, bless her heart, she's awesome. She does a lot of the legwork for me. As far as like finding certain places, because she knows the area real well. But just the staff here in general is just awesome. There's a saying that not all heroes wear capes. The staff here, they go above and beyond every day. I do sometimes think as residents here that we forget that they have lives outside here. You wouldn't know that by interacting with them every day. They bring their A game here every single day, even if they have something going on in their life. They make sure that we're taken care of. But among that, I think maybe even the bigger thing for me is the sense of community here. Out of everything that I've done here or have been taught or just observed, the friendships and the bonds that I've made with everybody here, staff, residents, janitors, I mean, everybody that's employed here, they're good people. They make sure that you are set up when the day comes that you leave. I really feel like in order to fail here, you almost have to want to. Either that or you're just not ready, which there's nothing wrong with that. But it is, if you're doing what's required of you here, it's very hard to not be set up for the best possible outcome when your day's done here. And also, I don't know, before I came here, I was just broken. And now I'm a social butterfly. I'm a leader, which is something I never thought I would be here. Just people come to me about everything because they know that they can lean on me, and then I will do the same for them. But I don't know. This place is very near and dear to me in my heart. The day that I have to leave, it's coming up, it's going to be a bittersweet day.
Yeah, and we appreciate the fact that you found a place here and are moving on. Man, sounds like your experiences have been a testament to what they've done for you and what you've done for yourself also. So we appreciate it. Thank you very much for sharing your personal experience and your personal journey. Do we have any questions or comments from anyone?
First of all, Matt, thank you so much for sharing your story. And I know that was out of your comfort zone, but I'm really proud of you, buddy, and you got a great future ahead of you. And honestly, as a board member, these are the types of things that warm my heart, and I know our money's going in the right place. You know, this young man has been changed because he made a decision to stop the cycle of his addiction, but then he also did one more step, and he's going to become very, you know, financially stable. He's going to have his own place. He's got a job. You know, he's not, you know, like he said, stuck in his house for 3.5 years. So I'm really proud of you, and thank you. He's a great success story for you.
Thank you.
Thank you, Jane. Any questions for Gail or for Matt? Yeah, go ahead, Julian. Unmute yourself.
Sorry about that. A question for Gail. Could you say a word about the demographics of the 37 people that received the services?
Sure. So I don't have the exact numbers in front of me, but we do, again, we have more male beds than female beds. So we have served more males than females in the recovery home. We've averaged around, don't quote me on the exact percentage, but it's roughly 20 to 30% have been African American or of some mixed race in the recovery home at any given time. So we're mirroring a lot of the same demographics that we see in substance abuse treatment overall. With that, we're within substance use nationally, actually, but also locally. You see more males who are seeking treatment, and also the demographics with some of the African American clients or people who are seeking services is actually a little bit lower than what we see in the Caucasian community. And some of that goes to stigmas that are involved, and some of it goes, they've actually been starting to do some research on the why behind it. Why aren't people from the African American community seeking treatment? And so we're starting to get a better feel for that, but we're actually glad that our that the demographics that we have, our data is showing that we are mirroring the local community a little bit closer than some of the national percentages that are out there. I can get you the actual percentages if you'd like them. Again, also age-wise, we've run the gamut all the way from 18 to people who have been over 65. However, the majority, again, of the people that we serve end up being in the 26 years to 40-year-old age range. So we get some young adults in there. Again, that's mirroring some of the national and local averages for people that are seeking substance abuse treatment overall.
Thank you.
Any other questions, comments? So those are the 3 presentations for today. Very informative. Thank you, Matt, for sharing your personal journey. Thank you to all the 3 agencies. And NAMI, please keep in touch. Okay. Are there any board announcements? So would someone move to adjourn?
I so move, Susan.
I'll second.
Okay. So we are adjourned. See you next month. It's getting warmer, so enjoy the outdoors if you can, and have fun. Take care. Have a good night.
Thank you, you
Bye-bye.
too.
Good night.